If this persists, people will die. We must stop this. We have to reopen.
The Lachine Hospital has been struggling to keep their ICU and ER operating consistently for the last year. This time, Lachine locals and healthcare advocates joined forces to march around the hospital in hopes of keeping the services open 24/7 and ensuring ambulances aren't redirected to other centers.
This is for the safety and for the lives of the population. We know that in studies that whenever you close an emergency room to the local community, you have an increase in death rates, particularly for time-sensitive illnesses like heart attacks.
According to Dr. Saba, the time delay of bringing patients from Lachine to other hospitals can lead to lives being lost.
It's unacceptable that they're redirecting these services elsewhere to supply the downtown hospitals. We're geographically isolated here as opposed to the other hospitals that fall under the MUHC umbrella. We should have all the services we need to care for our communities, not just us. We've got Dorval, we've got Valois.
All the mayors unanimously of the West Island are in support of keeping our hospital open, keeping the hospital open with a fully running emergency room with intensive care units.
The other closest hospitals for Lachine residents are the La Salle Hospital, located 15 minutes south by car without traffic, and Lakeshore, which is a 20-minute drive away.
The Lakeshore, the only other hospital on the West Island, is running at 175% capacity. So it would just overflow the other hospitals, and the Glen is also at 154%. So we do not understand this, and we hope that the minister will take the right decision and keep our hospital open and running with its emergency rooms.
We have a fully staffed ER with physicians as well as nurses. We even have now that we've spoken recently to intensive care inhalation therapists, we can reopen even our intensive care. So this is a bad healthcare policy decision, and we're asking the government and the McGill University Health Center to reopen.
MUHC responded in an email statement sent to City News about the community's demands against these cuts, writing they are prioritizing the hospital's modernization project, which includes developing clinics for inpatient follow-ups.
The plea is to the government and to the McGill University Health Center, keep it open, keep it fully functioning. We don't want a ambulatory care center. We don't want a mini emergency room. We want a full functioning emergency room open 24/7 with ambulances.
A petition was launched on the National Assembly website, garnering over 500 signatures. It is calling for the Quebec government to intervene and help the hospital get these services back so it can operate at full capacity again. In Montreal, Diona Macalinga, City News.